Good morning, Mr. Geller. I'm so glad that you're going to get to go home today. So during your stay here, we discovered that you have asthma and that your other medications haven't been working very well to prevent your attacks. Asthma is the chronic inflammation controlled by a lot of different chemicals in the airways. There are two responses to asthma in the body that can lead to the scary symptoms of an asthma attack. One is bronchoconstriction, which is the swelling of the airways that makes it hard to breathe and that gives you the shortness of air, shortness of breath, that kind of thing. Second is inflammation, which causes the body to release a bunch of different chemicals when exposed to different things like pollen or smoke or kind of anything. This leads to something called acute exacerbations, which basically means the short episodes of not being able to breathe very effectively like you had when you came in here. So inflammation in the airways can eventually lead to irreversible damage if we don't control it and treat it. So we want to be able to limit and control your episodes. So the doctor has prescribed some medication to help prevent these episodes from coming back. I know you're probably curious as to why you got this condition. Fortunately, we don't know the exact reason, but I know you said that when you were a child you had a lot of allergies, and also that your father used to smoke a lot around you, and that this kind of puts you at higher risk for having asthma. And then also kids that have a lot of respiratory tract infections, and also people that live in urban towns with pollution can get this disease either, which I know you had both of those in your childhood. So you've been prescribed something called theophylline to help prevent asthma attacks. The way this medication works is by stopping something called phosphodiesterase, which then increases your body's levels of the CAMP enzyme. I know that's a lot of big words, but this enzyme will kind of lower your symptoms by kind of increasing your heart rate, getting your cardiovascular system a little jolt, and it lowers the amount of some chemicals involved with the swelling of your airways so that you don't get that bad response every time. So this medication has a lot of side effects that we do want you to watch out for while you're taking it, especially during the first few weeks that you take it. So just to clarify, you don't have any seizure disorders, correct? Okay, good. I just wanted to double check because this type of medicine can cause seizures, especially with patients that have some type of seizure disorder already. Also, you don't have any heart issues like dysrhythmias or palpitations or anything like that. Okay, good. Just wanted to double check because this type of medicine, as I said before, kind of works to increase your heart rate. So we don't want you to have any kind of issues with your heart while you're taking the medication. So the main thing we want you to watch out for is something called toxicity. This medication has a very short window of being therapeutic, like medication-wise, like the amount we have to control. So we have to get the medication correct so you don't present any bad symptoms. So be sure to watch out for any kind of nausea, vomiting, diarrhea. If you have any problems with that, that could be an indication of toxicity. And then also watch out for kind of headaches and heart issues, like I kind of said before. If you have any problems, just call us. We can change the amount of you're taking. We might need to do that. And then we might even try to change the medication, put you on something differently. We will have you come back in a couple weeks just to make sure you aren't having any stomach issues or toxicity issues like we said before, and also to make sure that the medication is working, because we'll need to draw some serum lab draws just to check the levels. Try to avoid caffeine and smoking cigarettes, as this can affect the medication, kind of lower the absorption and that kind of thing. So I know that was a lot of information at one time, but can you tell me what you are going to do when you get home? Okay, thank you.